Hi, my name is Dr. Wellens, and it's time to go back to school. So, of course, what kind of issues do we expect to see in our kids, in our teenagers when we're going back to school? So, of course, everybody was off for the 3 months of the summer, and now that the kids are back to PE, they're back to their sports. Probably the most common thing that we see is stress fractures. So basically, it can happen to anybody, and kids are definitely not immune to it. So sudden increase in physical activity, or wearing incorrect shoes, or old shoes, or shoes that are too small, definitely are the risk factors that will predispose your child for stress fractures. The symptoms that any parent should look for in situations when a child is limping is increased pain, increased swelling, child not wanting to participate in a PE class or sports or certain physical activity, and also limping after they play a match. Again, I do want to emphasize one thing. Just because your child is limping does not automatically mean that your child has a stress fracture. I mean, we see things like inflammation of growth plate or tendonitis or even tendon tears that can mimic stress fractures. And of course, seeing a specialist that can properly diagnose and treat your child is going to be a key to proper manage your child's discomfort or pain. So let's talk about shoes. Definitely you want well-supported shoes with good orthotics, good arch supports. You want to be sure that they're correct size and fit, and they're also sports specific. So please, if your child plays tennis, do not put them in basketball shoes and assume that it's okay, and vice versa. And again, I have seen so many injuries of kids and teenagers over the summer where they're staying home and then they decide to go outside and play some hoops, and they're wearing flip-flops, and then there is a jump, and then there is an ouch, and next thing you know, you're dealing with a pretty serious injury that might require surgery in the future. So please, just because you're doing it for a short time, do not compromise, because injuries can be very serious, especially if you are not wearing proper shoes for this specific type of an activity. And things can happen very fast. So regarding selection of the shoes, I would definitely recommend seeing either a specialist or going to like a shoe store that specializes in fitting your child for this specific sports activities. Especially since I am in Florida, we do see a lot of young golfers that are, obviously need to be properly fitted, and a lot of my pediatric patients end up wearing orthotics in their shoes as well to prevent re-injuries or also to prevent any type of tendonitis in the future. So bottom line is, please, if you start a new sport or if you start an activity that you have not done for a couple of months, you need to understand that your body takes a couple of weeks to get used to it. So do it very slowly. And also remember to trust your body. If something is going on and you're having discomfort or your child is complaining, maybe it's time to take a step back and reevaluate instead of pushing them to do something that causes pain. And remember to see a specialist, podiatrist, foot and ankle specialist, anybody that can help you to assess the injury if there is one present, so you do not continue to put your child or yourself in danger and continue to re-injuring something. Yes, I have seen plenty of stress fractures in 17-year-olds who are completely healthy with no past medical history, and I can tell you things can go south very fast. Thank you.